I want to set the record straight on drains and seromas after tummy tuck surgery. Depending on the techniques you have learned and utilize, advanced techniques we are able to do drainless tummy tuck surgery on with almost no seromas. However, those techniques are not widely known and not being taught, and the result is that most of the tummy tuck surgery that's being done out there was taught years ago and leads to high rates of seroma formation and the need for long-term drains. If you have a drain in that's draining in over 100 cc's more than a couple weeks, you have a seroma cavity that's going to form no matter how long you leave that drain in. There is no point in leaving that drain in other than leaving it in just to prevent the need to remove it with a needle in the office. The problem with leaving a drain in is that you can get an infection and that can infect the entire seroma cavity and require surgery to go back to do. Once after 2 to 3 weeks you form a pseudocapsule if you're draining, that is a permanent relined cavity inside your abdomen. I did a YouTube video on this. Go check out my page to see what it looks like when it takes to fix one when I did one from another surgeon. So bottom line is, if you have a drain in more than 2 to 3 weeks, you had a conventional tummy tuck, right? You have a pseudocapsule in there. You might as well remove the drain and just aspirate the fluid with a needle. Now, if you've traveled out of the country, of course the surgeon is going to want you to leave it in because they don't want to have to deal with it when you're there and having to drain you. So they'd rather have you remove it when you leave the country or leave the state, that sort of thing. So that could be a red flag out there that you need to be aware of. Make sure that your surgeon is up to date with the latest techniques. You shouldn't need drains more than 1 to 2 weeks maximum. Most of the time, if it's only needed 1 to 2 weeks maximum, you probably could have had it done drainlessly anyways. So keep that in mind. If you get a seroma, you can have it drained. Most of the time it will go away, but if it persists, you will need surgery to have it treated, and that is a very complex surgery, and you will need to see a real body contouring expert at that point. Have a great day.